We will discuss today the advances in genomic and data-driven technologies which are rapidly reshaping diagnosis, surveillance, and management of infectious diseases. In this interview, I and Dr. Liliane will discuss the impact of genomics, artificial intelligence on infectious disease research, clinical practice, and public health.
Thank you, Dr. Nermin, for the great introduction. Let me introduce you to the audience. Dr. Nermin Osman, she is Assistant Professor of Biomedical Informatics and Medical Statistics at the Medical Research Institute of Alexandria University. She is a postdoctoral research fellow with the Cancer Surveillance Branch at the International Agency for Research on Cancer, IARC-WHO in Lyon, France.
Thank you, Dr. Liliane. Dr. Liliane holds a PhD in infectious disease and microbiology, and her professional background includes working as a researcher in several research institutes with focus on applied microbiology and antimicrobial genomics. With this background in mind, we will begin by discussing how genomic has influenced infectious disease diagnosis and management.
Actually, genomics has fundamentally transformed infectious disease diagnosis and management by enabling pathogen identification at the molecular level through approaches such as whole genome sequencing and metagenomic sequencing. It's now possible to rapidly detect pathogens, including those that are rare, unculturable, or present within complex mixed infections. For example, metagenomic sequencing has been widely used to rapidly identify SARS-CoV-2 directly from patient samples, while whole genome sequencing enables precise strain identification of Mycobacterium tuberculosis, even when cultures are slow or negative. Beyond identification, genomics allows early detection of antimicrobial resistance genes and virulence factors. This information directly supports targeted therapeutic decisions, reducing reliance on empirical treatment. At the public health level, genomic data enable precise tracking of transmission routes and outbreaks, strengthening infection prevention and control strategies. Overall, genomics has shifted infectious disease management toward a more precise, timely, and personalized model of care.
Perfect, dear Lilian. What role does genomic play in controlling outbreaks and antimicrobial resistance?
Yeah, actually, genomics plays a central role in outbreak investigation and antimicrobial resistance surveillance. By comparing pathogen genomes, it's possible to establish epidemiological links between cases, identify source of infection, and detect transmission events within healthcare or community settings. This genomic resolution far exceeds what is achievable with conventional microbiological methods. For instance, WGS has been used to trace hospital outbreaks caused by carbapenem-resistant Klebsiella pneumonia, enabling rapid identification of transmission chains and implementation of targeted infection control measures. In the context of antimicrobial resistance, genomics enables the identification of resistance genes and mutations, often before clinical treatment failure becomes apparent. This supports antimicrobial stewardship by guiding appropriate therapy and informing infection control measures. At a broader scale, genomic surveillance provides public health authorities with critical insights into the emergence of spread of resistance strains, allowing for timely updates to treatment guidelines and prevention strategies. Allow me, Dr. Nermin, to ask you, based on your experience, how do you think artificial intelligence is expected to integrate with genomics in infectious diseases?
Okay, dear. Artificial intelligence serves as an essential link between complex genomic data and the clinical decision making. Genomic datasets are large and highly multidimensional. AI-based methods are well suited to analyze these data efficiently and at scale. AI can be used to predict antimicrobial resistance directly from genomic sequence, support pathogen classification, and detect emerging variant in near real time. More importantly, AI facilitates the integration of pathogen uh, genomic data with clinical and epidemiological information such as lab results, patient risk factors, and outcome. These integrations support advanced clinical decision support system and strengthen early warning symptoms for outbreak. In the future, AI-driven genomic platforms are expected to play a key role in advancing precision infectious disease medicine and enhancing public health surveillance. It was my pleasure discussing this important and rapidly evolving field with you today, Dr. Liliane.
Thank you. Yes, indeed. Shared pleasure. Thank you so much.